Good morning to you, Dr. Okolo. How are you this morning?
I'm very well. Thank you very much for having me, and thank you for featuring KWISA on this amazing platform. Yeah, I'm a big fan of Jambo Radio, so it's nice to be on with you this morning, George.
Excellent. We're glad to hear that. Thank you very much. I think we should just get into it. The first thing would be, can you tell us what is the CSW68 NGO forum? Because that's something that is a bit the abbreviations of all this technical diplomatic use of language is confusing at times. Can you break that down for us, please?
Absolutely, no problem, George. Also, I should say I'm also joined online by my co-host, Dr. Kizanne James-McCarthy. So hopefully we'll get to chat to her and speak to her as well.
No
But
problem.
basically, the Commission on the Status of Women. So this year it's the 68th session, and this is essentially the largest intergovernmental meeting of members from the United Nations states, representatives from different governments, civil society, and basically activists. It's the biggest gathering of people focusing on gender equality, gender empowerment, women's equality. And this happens every year, usually in March, over 2 weeks. And it's physically based in New York, but many of the events are virtual and hybrid. And we this year are participating in the NGO forum as part of the CSW. There we go. We got Dr. Kizanne James-McCarthy joining us. We are participating this year in the NGO forum section of this, which is really exciting because, to my best understanding, we've never had an event hosted in the Scottish capital. So we're very excited that KWISA is paving the way for this amazing event.
And based on this conference, thank you, Dr. Kizanne, for joining us as well this morning. In terms of both of you are hosting this conference, what is the need for this conference to happen?
Over to you,
There's such a
Kizanne.
great need. I currently work for the NHS, and I'm one of the only Black women in management, just Black person in management working in the NHS. And we are seeing an increase in the population of Black women and Black men in Scotland, but there isn't an increase in the support services, in the policy, in the resources that's being available for us as we contribute to the Scottish economy and Scottish services. We're educated, strong community, and we just want to make sure that anything that is being developed for Scottish people includes us because we are here as well, and we are part of this community. So there's a great need, in particular, in terms of healthcare.
Yeah, healthcare is a very big, topic. It's a massive concern, especially for people of African and Caribbean descent.
Mhm.
But given that, just asking, what do you think this conference is going to influence? Will it change policies? Is that the objective of the conference, or is it just to create awareness?
I mean, we're
Yeah,
hoping for
so
a bit of both.
yes, absolutely. So the conference has several objectives. The key one is to showcase a bit of the work KWISA has been involved with over the years in terms of its inception, focusing on its collaboration with partners. And it's also an event to bring together individuals that represent community members of African and Caribbean descent to talk about issues that impact us. And then we've also been strategic with regards to who our expert panelists are. These are people who represent various segments of society that KWISA has in the past co-created with. And we really want to have in-depth conversations to challenge us to think about innovative ways of co-producing in a way, like Kizanne said, that really centers African, Caribbean, Black communities. Because often we are left out of the conversation and the expertise is within the community. So we hope it will be an event that convenes, that inspires strategic partnerships, but also that inspires people to think about, learn about how to co-produce with other minoritized communities as well as Black and African Caribbean communities.
Given your experience, Dr. Kizanne in the NHS, what are the challenges you think the NHS as a national institution? What do you think are the challenges that they face to to be inclusive and to be to create that health equality, or perhaps even tackle some of the challenges that people of African and Caribbean, some of the health challenges that people of African and Caribbean heritage in Scotland experience?
Yeah, so I mean, there are many. I think one of the major things is that this system wasn't created to be inclusive. So the structural system, and we talk about structural racism and inequalities, and so we don't have good representation in the decision making for how the NHS moves forward and what resources are shared, and Isioma and I have had many conversations about that. When you don't have the right people in the room, it's very difficult to make sure that we're considering the needs of everybody. So if the ones that making decisions aren't representative of the community on a whole, it's not going to be decisions that would care for the needs of everyone as much as you would like it to be. The current political and economic situation, I think, is a challenge, as we know that the NHS has very long waiting times currently, and as this is all public knowledge, there's long waiting times. Post-COVID, the NHS is also struggling, and so there isn't it's not as much of a priority, because sometimes people think, oh, ethnic minority communities are small communities. Black people in Scotland make up 0.7% of the population. So then why should we invest in helping or building the health needs of those in these small communities when we have 99% of the population that don't belong to these communities? So they see that as less of a priority. And at this conference, we aim to change that perception, because that isn't true. When we support the needs of Black and ethnic minority people, but in particular Black people, we help everyone by extension. It's the human race. We are all one people. And so we need to make sure that whatever we're doing considers the needs of everyone, particularly public services, as I said in my first answer, because we're all part of the community.
Yes, we are part of the community. I think the other question I would like to ask is, this conference is just a one-day, event. But do you think the conversation? This is the start of the conversation with the stakeholders and the community. And what would you like to see as the outcome of this conference?
Yeah, so we are hopeful that this is only the start of the conversation, because actually in the lead up to the event, there have been many conversations around, first of all, who to partner with to host this event, who to invite as a panelist, but also in the audience. So we are hoping that it will be the start of many fruitful conversations. And in my background as a clinician, so as specifically as somebody who works in women's health, what I see at a national level is a bigger focus on addressing health disparities for ethnic minority communities, and specifically in maternal health. As we know, unfortunately, Black women have higher amounts of adverse outcomes. And this is again linked to the service design and provision that Dr. Kizanne was describing. And even though some of these communities are a smaller part of the population, what we know is that, unfortunately, adverse outcomes cost all of us, right? Not just the communities impacted. They cost all of us because they are preventable and they are unfair. So in many ways, when you notice an inequality of any kind, whether it's employability, education, or health, it represents a waste of potential and resources that could have been properly reallocated to prevent this adversity or variation. So I guess to your original question, specifically, we hope this will lead to conversations that will bring in the communities most impacted and use them as experts to then design services and to engage them in a way that is not tokenistic, not just, the what's that term? The poster child for whatever event XYZ institution is involved with, as true partners with power to promote change that Dr. Kizanne explained will impact everybody. A rising tide lifts all boats, and that's the absolute truth.
On the theme for this conference that's coming up on the 20th of March, disrupting the status quo of co-creation for women of African descent, and it's a hybrid event. So there's a kind of a description there of let's shake things up, and is it kind of a sort of a beginning of a new movement of activism to tackle the challenges that people of African descent face in the health sector?
Indeed,
or within the health?
History of advocacy, and that's a main pillar of the work that we're going to be doing in 2024. Yes, it's about making big changes. We know that how things are currently going, it's not in the best interest of Black and ethnic minority people. And so to get real change, we have to change the model, put it, they say, flip it on its head, have new people involved, have new mindsets, a wider way of thinking. Otherwise, we will continue to have the same outcomes that we're currently having, and we can't continue to see that happening, especially for our community here in Scotland.
Yeah, does any? Dr. Okolo, I'll ask you this: is there anything, given the fact that the nature of the thing that you do is kind of national? The kind of African and Caribbean, communities are non-geographical. Do you think that poses also a challenge in terms of how to deal with with how to engage the community in the health process, or to tackle the challenges, because the port of our communities are in kind of the port of different areas, so it might be difficult for different local health board or organization health board, to deal with this thing. Do you think that's a challenge, or?
I see that more as an opportunity, actually, because I guess what we are proposing is not a one-size-fits-all solution. We are proposing a framework, and the idea behind the framework is the T's is a community. What you need to do is invite them in and truly give them power to make change. What that will look like will be different in Edinburgh, it will be different in Glasgow, it might be different in Aberdeen or Dundee. So as opposed to a kind of universal approach that in a way is very typical of like Western ways of thinking, one size fits all. One size does not fit all. The only reason people experience adversity is because they don't fit the default. And the current default in our society where we live right now is white, male, cisgendered, heterosexual. So we need to focus on flipping that. And I guess what I want to acknowledge is the history of KWISA. So KWISA was established, like you said, George, 10 years ago by 4 brilliant African women. And specifically, I want to recognize the contributions of two of the main founders, Professor Mukami Makrum, MBE, and Ms. Esther Kamonji. So 2 powerful Kenyan women. So you asked the earlier question, is this a new movement? No, we are all standing on the shoulders of giants and hopefully continuing conversations that started ages ago, but injecting different kinds of energies into it. And we really want to bring people in, but also hold people to account, for some of the promises that have been made, and also give opportunities for growth.
Excellent, that's wonderful, and I think it's a lined up of really interesting workshops and panel discussions that's going to be happening on the 20th of March. Can you just give us kind of perhaps the running order of how the activities is going to be? I know the first panel discussion is going to happen on the subject. I think this subject is what. Sorry, I missed it out there. Anyway, but the panel involves Professor Mukami Makrum, who is the founder of KWISA, one of the founders of KWISA, and it's quite a lineup of really interesting advocates of different causes. Is this kind of a deliberate to ensure that those conversations are meaningful to the community, and also what's the intention of having this very high level advocates of different causes in a panel and at a conference like this?
Yeah, it was really important to us that anyone who attends these sessions, and I want to reiterate that this is a global meeting, so people across the world would be joining in and learning from the Scottish context and from the work that we're doing here. So it was really important to us that people attending at the end of it would have tangible skills and learnings from this meeting that they could employ in their pieces of work. We have intentionally invited very senior NHS officials, for example, the Director of Women's and Children's Services, Alistair Short. We have the Director of Public Health there as well, not on the panel, but just in the audience. We have Scottish Government officials who manage women's health inequalities and also just work with health inequalities on a whole. And we also have researchers, university officials, and most importantly, our community partners, people who work in this area, who advocate for Black ethnic minority people across Scotland. So yes, that was all intentional. And just the structure of the sessions, which we focus first on what is meaningful engagement, what does that look like from the service provider point of perspective and the point of view, and the community point of view. How are we missing that? Because it doesn't seem to be the same thing. And then we go into the challenges towards meaningful engagement, towards bringing people together and making sure that the suggestions and the opinions shared are taken on board. And lastly, we're going to work on building solutions together that we will be holding people to account to post-meeting. I don't know if Isioma wants to add anything to what I've shared.
Yeah.
Solutions.
Yeah, no, I think you said that very brilliantly. And, so obviously Dr. Kizanne and I both have a health background, but it's important to recognize this event is not just focusing on health, it's focusing on other issues that impact our community. So we're going to bring in conversations about education, about employability, about the social care sector, and really excited about the two other partners that we have on board in terms of partner organizations. So Mrs. Elizabeth Maya Chimonjis, who's the CEO of ACHMA, and also Ms. Vicky Nyanga Ndiaye, who's the CEO and founder of Project Esperanza. So again, representatives from community organizations that are in this space. Another aspect of the work we need to focus about with regards to disruption is how do we work together as communities, right? In a way that is collaborative and not competitive. So this is another aspect of the discussion we want to bring out. So we work well with each other and for each other.
Okay, and perhaps I should ask how can people participate in this conference? It's quite interesting that both of you are just waiting for one person to speak and then nobody said anything.
That's how we work together. We give space to each other, so that's how we work together. But
that's very collaborative.
Very collaborative. We're definitely partners. So there's an Eventbrite link that if you just do a Google of our session name, which is Disrupting the Status Quo, and you put KWISA, I've tested this myself, so I know it works. You will find our Eventbrite link. Also, if you go on KWISA's website, and that's KWISA, and you just go on KWISA's website, there's also a link there. It's being promoted quite widely, so all our social media channels, you could find more information about it, and the NHS as well is promoting it. So on the NHS Scotland's intranet page, if you go on there, you could click the link and you'll be able to, homepage, if you're not an NHS staff member, I'm used to saying intranet, sorry. On the NHS homepage, if you click the link, you could also join in. It's being virtually streamed, but also we do have some physical spaces. It's going to be located at the Chancellor's Building, which is on the Little France campus, where the Royal Infirmary of Edinburgh is based, not the Royal... Isioma, the other Royal...
not the Royal Ed, the Royal Infirmary of Edinburgh.
The Royal Infirmary in Edinburgh. Okay.
Okay. There are some spaces there, so if you want to come in person, and feel free to join and send in your questions, because as you can see, our panel comprises of some very powerful people that could really make some changes. So you could send your questions in, or come in person to ask these panelists any questions that you may have.
And remember, this is a celebration of International Women's Day, so we want you all to come and celebrate with us. We want you to come decked to the nines in your best attires. There will be some entertainment as well as light refreshments. So let's come, have fun, and have like very critical conversations.
Let's come and have critical and of course have fun and learning. What do you think would be, some of the how would some of the learning from this conference would be shared?
Mm-hmm. That's a very good question. So on the day, we will have people who are part of our team essentially summarizing some of the points that have come through. The meeting will be recorded. And the great thing about having this very important conference on the United Nations platform is that meeting as the video will be shared on that platform. So this is wonderful for an event hosted in Edinburgh, broadcast globally. But we also, as an organization, KWISA, will aim to share some of the learnings from it in a more digestible format. So like a small community report, some of it will probably be shared on our social media platforms as well.
Okay, and of course, can you? How can people join again? Just repeat that for us, and we'll also share the links on our social media platforms. What are the links again? Sorry.
So it's on Eventbrite, Disrupting the Status Quo.
Okay.
If you skip that and go on KWISA.
So it's on Eventbrite as a KWISA event. Yes, that's KWISA. Yeah.
Yes.
That's correct. Okay, and on Eventbrite, so you can find that and. Of course, Dr. Kizanne, you mentioned about the intranet there. I think I was also caught up by what's intranet again. I've forgotten that it's kind of an internal communication system. Right, anyway. So thank you so much, Dr. Kizanne and Dr. Okolo, both of you representing KWISA, and of course your conference that's coming up on the 20th of March, and that will be taking place in Edinburgh. What's the starting time?
2:30 p.m.
2:30 p.m.
Yes, so it's starting 2:30 p.m. in Edinburgh, and it's the Chancellor's Building, the University of Edinburgh, and that's based at 49 Little France Crescent, which is the Auditorium A in Edinburgh, at Edinburgh University. And I think you were saying there is that center is based around the Royal Infirmary of Edinburgh. That's correct. Yeah. Okay. Well, thank both of you so much for coming on the show this morning. I'm glad to have established a contact with you people, and thank you for the good work that you're doing. Please keep advocating. There is quite a lot of work to be done, and I think as a community we have to be supporting initiative as such. So for those of you that can go along or you want to join remotely, please go to Eventbrite and register to participate in this wonderful conference that's coming up, and it's called it's the conference on the it's being co-hosted by Dr. Kizanne and Dr. Okolo, and on the day the discussion will be around on the theme, disrupting the status quo and on co-creation with women of African descent. And of course this will be a global event, even though it's taking place in Edinburgh, and most of the conversation will be relevant to the African and Caribbean community. I want to thank you so much for coming on today on Jambo Radio. You have a nice day. Thank you.